The study shows COVID-19 has a more severe and lasting effect on socio-economically disadvantaged neighborhoods of Geneva. Joining us live from Switzerland is Christine Benedicto. Hello, Christine. How are you doing?
Hello, Alma. Thank you for having me. Recent results of a study coordinated by Geneva's University Hospital show that infections of COVID-19 affect more severely and for a longer period of time low-income neighborhoods of Geneva. The study is based on data from the first wave of the pandemic and divided Geneva into 2,830 housing cells. After 2 months, results show that clusters of infections remained only in 30% of wealthier areas against 85% in disadvantaged areas. It reveals that the pandemic is not only determined by the age or state of health of people, but also by the environment. The professor who initiated the study underlined that environment-related factors could be living in housing conditions, lack of space, and also differences in attitude towards case tracing technologies and social distancing measures. He emphasized that the study is not meant to label neighborhoods, but to provide help so tools can be put in place for more targeted and more effective public health interventions. Geneva has regularly been on the top list of Swiss cantons most severely hit by the pandemic. Its population density is very high compared to other cantons, more than 2 times higher than Zurich's, for example. In terms of current infection numbers, out of the total cases in Switzerland since the pandemic of more than 507,000, Geneva's cases represent more than 9% of that total number. In terms of case ratio per a population of 100,000, since the beginning of the pandemic, Geneva leads the country's SAD list at over 9,000 cases per population of 100,000. Fortunately, the canton's ratio in the past 2 weeks has improved to just above 360 cases per population of 100,000, close to Switzerland's current ratio as a whole. But compared to other countries, Switzerland's ratio remains too high, which is also why the government recently tightened its health measures. Back to you, Alma.
I know that Switzerland is a rich country, and this pandemic is an abnormal situation for all of us, especially for people there. Can you give us a picture on how the general mood is there and where you're at right now in Geneva?
Well, as the country is in partial lockdown, life is definitely quieter and slower. Non-essential shops can only do deliveries or pickup services. People are obliged to work and stay at home. Where possible, restaurants can only do takeout and deliveries. Cultural and sports facilities are either closed or restricted, and only up to 5 people, children included, can gather at the same time at home and outside. For now, primary and secondary schools remain open. If you look at Geneva, the financial district and shopping areas are definitely much less crowded. We currently do not have the winter season sale crowd in streets and stores.
All right. Thank you very much. And then looking forward for more updates there in Geneva. Thank you for your time. Always take care and be safe.
With pleasure. Thank you for having me today. I'm Christine Benedicto, reporting from Geneva, Switzerland. We live in interesting times.